Serving a community of 3 million people in Kampala's surrounding suburb is the China-Uganda Friendship Hospital. Covering 5 acres of land, the Naguru Referral Hospital was built on the foundation of Uganda's good relations with China. The hospital consists of 4 operating rooms, a maternity unit, an adolescent health unit, a blood bank, the radiology department, and housing for the medical staff. Waiting to see a doctor is Florence, who has brought her kid for vaccination.
I've come for treatment for the child and for immunization.
Executive Director of the hospital, Dr. Edward Nadumba, has been at the hospital since it opened in 2012. Currently, the hospital employs 356 Ugandan staff and a team of 8 Chinese medical volunteers who are deployed by the Chinese government at intervals every 2 years.
This place initially had a health center 4, which was under KCCA, and then between the relationship between Uganda and Chinese government, they decided to erect this hospital, which is at the level of a referral hospital, offering both general and specialized services.
The philosophy of cooperation between Uganda and China is even more apparent in the work structures of the hospital. In the ear, nose and throat unit, medical interns work alongside Dr. Wu to ease communication between doctor and patient. On average, 55 patients are attended to every day in this unit of the hospital.
Actually, it is good because there are very many patients. We book patients and up to the capacity we can see for the day. And actually, others we refer for the next day. So there are very many patients here. Only that there, the Chinese doctor doesn't know the common language, so we also help in interpreting the language.
Moving to the antenatal ward of the hospital, however, the number seems to double as women wait patiently to receive maternal care. With the partial closure of Murago General Hospital as it undergoes reconstruction, the medical team here in Naguru have to attend to greater numbers of people seeking medical treatment. The China-Uganda Friendship Hospital is growing increasingly popular in the community. With access to high-end equipment, doctors perform speedy diagnosis, which cut waiting time for the patients receiving the treatment. For many of the doctors, the fruit of China and Uganda's relationship is visible in the donation of facilities which help them perform at the best of their ability. For the patients, they get to receive vital health care without the heavy costs.
The services in this hospital are generally free, but we are just establishing a private wing whereby those who can afford, are attended to in the private wing. But that one is in its infancy. It's just being developed.
In the western wing of the hospital is a ward dedicated to acupuncture treatment. Acupuncture is a part of traditional Chinese medicine used to relieve pain in patients dealing with all types of conditions. The treatment works by inserting needles 1/10 of a millimeter in diameter in points where nerves enter the muscle, called acupuncture points.
I lost a son and I had a very bad neck. I had a lot of treatments but couldn't help me until I was advised to go to acupuncture in Jinja.
Thrice a week, Reverend Prudence Kado makes the trip from Mukono to Kampala to receive acupuncture treatment at Naguru Referral Hospital. As needles are inserted below the surface of her skin, a machine is attached to the needle ends and sends an electric current to the areas punctured. The result is a tingling sensation in the nerve that stimulates the brain to release endorphins to the body, which offer pain relief.
I must say acupuncture is a wonderful treatment, and I always advise so many people to come over because of the benefit I've received out of it.
Across town, Dr. Tang, an acupuncturist, performs the treatment on a patient in her private clinic.
For the hand, for this. Acupuncture in Uganda have many people is what accident, what stroke, brain stroke, that make the body half body paralyzer, what facial paralyzer, but the Uganda don't have good medicine to treat this. Only in Chinese acupuncture can make the paralyzer go away.
Yeah, so that's why I had to tell her where to get certain points that I'm feeling pain, so that I can see if it will work for me. So basically it was here, the neck, around the neck and the shoulders, this hand, and the feet, the side of the feet where she put the pin, where I told her was hurting. Yeah, so it is only those parts. But for this part right now, I'm good.
You see, it's very easily, not feeling pain. You feeling pain?
Yeah, slightly.
Yeah, you see.
While evidence in the scientific community agrees that acupuncture works for problems including neck pain and post-chemotherapy symptoms, it is not conclusive for its wider range of use. Long-term users of the treatment, like Reverend Kadu, stand by the treatment as an effective form of therapy.